Hey there, Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about the different methods of surfactant administration in neonates. Surfactant can be administered via several methods. They range from high-invasive to non-invasive, and the skill required varies to perform safe and effective administration. The high-invasive method or the traditional method involves visualization of the larynx with a laryngoscope and inserting an endotracheal tube, ET tube, into the infant's trachea. The ET tube is secured at the correct depth, followed by administering the surfactant in one or several boluses, and then placing the baby on mechanical ventilation. Another method is INSURE, or in-and-out surfactant administration, is similar, but only involves a quick intubation and surfactant delivery followed by immediate extubation. The patient can remain on their oxygen delivery device or CPAP, and thus when the ET tube is removed, the pressures remain constant without pause. Additionally, there is less invasive surfactant administration known as LISA, where the larynx is visualized using a laryngoscope, but rather than an ET tube, a thin catheter is passed through the vocal cords into the trachea. Then surfactant is given slowly while the infant continues to breathe spontaneously under continuous positive airway pressure, CPAP. Once the surfactant is administered, the catheter is removed. The infant remains on non-invasive ventilation throughout the procedure. Dr. McGlinn has a great video demonstrating this procedure. There are also methods that do not require the use of a laryngoscope. The first of these methods is called SALSA, surfactant administration through laryngeal or supraglottic airways. With this method, a laryngeal mask airway, LMA, or another supraglottic airway device, SAD, is placed, and the surfactant can be administered through a port on the LMA or used to guide a thin catheter. This method is easier to learn and perform than intubation, aims to reduce complications associated with the procedure, and can be beneficial in diverse healthcare settings, particularly in low and middle-income countries. There are also non-invasive methods of surfactant administration. The first is mist, or aerosolization nebulization. With this method, surfactant is delivered to the lungs as a mist or aerosol, using devices like jet nebulizers, vibrating mesh devices, or heated capillary devices. The second non-invasive type is pharyngeal administration, where surfactant is placed in the pharynx, and the infant is stimulated to inhale it with their breathing. This method is simple but limited to spontaneously breathing infants and may not be suitable for all situations. When deciding on the method of surfactant administration, there are several key considerations. First, clinicians and staff must be well-trained and follow established guidelines for successful implementation of these methods, including but not limited to proficient intubation skills, correct depth placement, and dosing. Second, less invasive methods, particularly LISA, reduce the need for mechanical ventilation, which carries risks like pneumothorax and bronchopulmonary dysplasia. Finally, continuous monitoring of the infant's vital signs is crucial during any surfactant administration procedure. Be sure to like and subscribe to McGlinn Institute Neonatal, and join me, Baby Doc, for more sage advice.